Welcome, everyone. Thanks so much for joining today's webinar, Medicaid Promoting Interoperability, the final pitch. Today, we have presenting Selena Williams, Program Manager here at Hybrid Solutions, and also Francine Jackson, Mapper Outreach Representative at Gainwell Technologies. Our webinar objectives for today are to revisit commonly used errors, summarize program requirements, and also review tips for a successful attestation. Thank you so much, and I'm going to go ahead and turn it over to Francine Jackson.
Thank you, Brianna, and welcome to today's webinar. First topic we're going to talk about are the common provider attestation errors. And the first error that we see that a lot of providers make is the mismatch error. You will need to make sure that on the GAM is the same as to what you have on the national level registry. Now, this is just a couple of examples to show you what exactly what we're meaning. Now, the first example you see is the Social Security number. As you can see in this example, the last 4 digits are correct, but however, in the first partial, there is something incorrect. And actually, you would only know that which information needs to be corrected versus GAMIS or the national level registry. Another error that we have is the extended part of the zip code. You must include that as well. And also, if there is street spelled out in GAMIS, it needs to also be spelled out onto the CMS National Level Registry as well. You want to make sure that you are in the current location. In this example, we showed that the A location was used. However, if you look below where it says service locations currently able to access Mapper, you show that it says B location, which means yes, that is the correct location, that Mapper applications exist. And this is the yes or no button. This appears on the Get Started tab on the very first part of your application. Now, on your application, you want to make sure that all the information is correct. And if you click yes at the bottom, that means that you are certifying that the information on CMS is the same as what you have on the GAMIS website. Now, if you click yes and the information is not correct, then you're going to receive an error message at the very bottom that says refer back to CMS. This example shows when a provider used the incorrect payee 10 or MPI number. You're going to error message with red check mark, and it's going to say the MMIS system does not contain a payee record for the MPI and 10 combination received from the RNA. Now, when it says received from the RNA, that means it's coming from the registration and attestation system. So that means that's CMS. You will need to actually correct the error. If you do not correct the error, then what's going to happen is if you continue on with your registration and go all the way to the end, then you're not going to be able to attest until the next program year. And the reason is because at this point, we don't know exactly where the payments go to. We don't know what information is correct. So you may want to make sure you correct that information and then move forward. In this particular error message, this is when the incorrect RNA number was used. What you can do to get the RNA number, you can log back onto the CMS National Level Registry. You can retrieve that RNA number, or you can contact our Mapper department. And what we will do, we will authenticate some information from you, and we'll verify that RNA number. Okay, in this particular error message, this is the incorrect provider ID used. In this situation, there are no ID numbers associated with Mapper. So you want to make sure that you look back at your records and make sure that you're using the correct ID number to get into the system. This is where you forget your national level registry password. In this particular incident, sometimes we have providers that are provider contacts that are new working in the office. Say, for example, they may not have been given the correct information as far as the password, or they may have actually forgotten their password that they actually previously used. You can actually contact the phone number below. It'll actually just give you instructions on how to reset the password, or you can click on the website below that says PCOS, and it'll also tell you how to reset the password. These are the instructions to resetting your password. You want to click on the PCOS website. You want to click on Forgot Password. It will then take you in a system where you would then actually change the password. Now, that same password that you use on the INA system, you're going to use it to log back into the CMS National Level Registry. In the next portion of this webinar is going to tell you how to update your provider demographics. If you need to update your demographics on the CMS National Level Registry, you're going to log on to the website, you're going to click continue, and you're going to scroll all the way down to the acknowledgement box and then click continue. You're going to enter your username and password, click enter, make all the corrections all the way to the end of the registration, click submit. You're going to wait 48 hours for the update to place in CMS before going to the Mapper system. So in other words, don't go back into the Mapper system as soon as you make the correction on CMS, because the information has to upload and the information has to switch over. So wait 48 hours before going into Mapper to continue your registration. Accessing Gamet's Medicaid change of information request form. In this situation, this is when you have, when you are needing to update the demographics into the Gamet's website. So you want to click on the Gamet's website, then you click on Web Portal, then you're going to click on Provider Messages, Switch User. Next slide. Then you're going to go to Providers and then Change of Information. You're going to click on Change of Information Request. You're going to select whatever you needed to update. Say, for example, if you need the address updated, whatever you need to be updated, you're actually going to click on it here. So you're going to review the options and select the appropriate action. And also you're going to actually make sure that you put the effective date of the change. The final step is you want to click next to complete all the necessary fields and ensure that you submit the request. And last, you want to actually follow up with the provider enrollment department. Typically, it takes them 15 business days to make the changes. So if you are approaching the end of the program year, you want to make sure that you get that information updated quickly. You can actually reach out to them by the 800 number and select the option that says provider enrollment. All right, and now I turn it over to Selena Williams of Hybrid Solutions, and thank you for listening.
Good afternoon, everyone. Thank you so much, Francine, for that wealth of information. Want to make sure we get these applications submitted correctly. There is no other chances. It is the final program year, so we want to make sure we get you all the information you need to attest successfully. Okay, so we're going to go over the 2021 program updates and reporting requirements that have not changed since 2020. You will need a 90-day PI dashboard. That's any consecutive 90 days in your dashboard where you've passed all your measures and met all measures, objectives, and measures. A 90-day patient volume, PVC. Also a 90-day clinical quality measure. I know a few providers, as we spoke to them during this time and during 2020, they had a difficult time or some challenges pulling a 90-day clinical quality CQM. And I think Athena was one of them. They were only able to pull one for 365 days. So if you are having that problem, reach out to us. We can assist you, give you the workaround of what DCH has given to us to inform you on what to do if you are having problems pulling a 90-day clinical quality report. Of course, this is the end of the program, 2021, and the deadline to submit your application is September 30th. However, we encourage you to get those applications in as soon as possible. We're here to help. We're here to assist. Again, as Brianna mentioned, we're state funded. There's no cost to your practice, and we want to assist. We want to make sure you get your applications done correctly. We can do a screen share via Zoom or whatever platform you choose to use to assist you with going into Mapper and submitting your applications. So please reach out to us. Okay, so promoting interoperability. Of course, as I mentioned, not many changes to the submission process of the PI from previous years. But what you do want to make sure is that before you go into Mapper, before you sit down and start your application process, you want to make sure you have your certification number from your EHR, because you're going to need that, and along with your login information. So you're going to need that before you can go any further. It's going to ask you for that number. So make sure you have that handy before you start your process. You will need the number of encounters during the 90-day PI period, the denominator, and the number of encounters that were documented within your EHR during the 90-day PI period, the numerator. Of course, have all your documentation ready. You want to have your PI dashboard ready with all your scores visible to ensure you are passing them. And so we're just going to go over, this is just a few of the measures, notating all the measures, what's required. We're going to go over all those, and I'm just going to kind of point out at this point, I'm just going to kind of point out the ones that's been a challenge in the past to make sure you have the documentation, the exclusions, and everything that's required when you submit your application. Okay, so let's start with the first one, is the protected health information. That's your security risk analysis. And this is very important. I know that the years 2020 and 2021 have run concurrent. So with that being said, a lot of providers have just completed their SRA and submitted it for 2020. So this is what you could do for 2021. You can submit that same SRA that you submitted for 2020. However, you do need to have an SRA completed by the end of the year, completed by December 31st, in case you're audited, because they may come back and ask, but they are making some special provisions and workarounds, since a lot of some of the big hospitals and some of the big facilities, they only have it done once a year towards the end of the year. So they are doing some workarounds as far as that. But please just also make sure when you are submitting the 2020 that you go in and revisit and see if there's been any threats and mitigations between the last time you completed the SRA. So that's very important that you do that. If there is any changes, make those changes before you submit that. And then when you submit when you complete it for 2021, you can always upload that. Well, I'm not sure if you'll have access to upload it, but you will also just make sure you have it handy in case they come back and ask for it. That's very important. Next, what did you keep it on this slide? And the next one is the clinical. You guys already know about the query for the drug formulary to make sure that you meet that's 60%. Be sure that your drug formulary is enabled. You want to take a screenshot of that, because that's something else that may be asked of you to upload, that will be asked of you to upload with your documentation requirements. Your clinical decision support rules, you want to choose 4 clinical quality measures that's related to your reporting period. You have to have 6, but for the clinical decision support rules, you want to take a screenshot of 5, and they must match the clinical quality measures that you chose to report on. So you want to make sure you have that also when you submit that with your documentation requirements. And so I mentioned the implementation of the drug allergy interaction check. You want to make sure that's enabled. And then these are the other measures. We'll go down and talk about the API a little bit. And Brianna may have you to let Liz in. I'm going to talk about the percentages on this. Okay, yeah. So the API requirement, it's a few slides down, but we just kind of want to make sure on this one you have to meet the 80% and the patient education portal. But with the API, we want to make sure that the providers are giving their patients the documentation to access any API that's compatible and available to them through their EHR. This is very important. We've had providers being audited because of this, because the providers did not provide this information. So it's very important that you are giving this information to your patients when they come into the office to be seen. Okay, so health information exchange. I know a lot of providers have had a problem with meeting this measure. You have to attest to all 3, but meet two of these measures. So the first part of it is a percentage of 50% or greater. The HIE portion is receive electronic data, 40%. So it must be bidirectional, coming from if a provider sends their information to a provider and vice versa. So it must be able to track that going both ways, bidirectional. Medication reconciliation greater than 80% on that measure. Okay, and so the public health clinical data objective 8, the public health and clinical data registry. You must attest yes to participating to at least 2 or meet 1 and exclude 4. 1 in each area. And so with this, I know most people in the past, we've provided information on syndromic surveillance that's not required in Georgia. So you do not have to submit that data when you're doing your submissions. Brianna, let's unmute Liz and see if she wants to add something around public health registries. I know there's been a little confusion around the attestation and what providers need to report on this measure.
Thank you, Selena. Can you hear me?
Yes.
So there were a couple things that I wanted to mention. The first was that make sure that your system, to reiterate back on the registry for immunizations, make sure that that registry is functioning bi-directionally. We have had some issues on audits where, and actually on submissions where the providers didn't know that they weren't bi-directional. They thought they were bi-directional. They thought they were paying for bi-directional, and they were only unidirectional with grants. So please make sure it's bi-directional both ways and that you can prove that. The second thing we wanted to say was when you're looking at these public health registries, we have a lot of folks that aren't doing the due diligence. So on an audit, it's hard to prove what you've done. So, and if you have to exempt one, you have to exempt them all five. So please don't fool around with this one. There are registries available to, there's at least one that's free within the state that's available to you. And make sure that you've got these right, because they can come back and bite you in future years on audits. Thanks, Selena.
Thank you, Liz. And I think we've talked about the requirement for the CQMs. If you're having any challenges pulling a 90-day report, it must be the same 90-day date range for the PI report. Should include one outcome or one high priority measures. And then, of course, it doesn't have to meet a threshold for this requirement. Okay, so let's go over the submission documentation requirements. We want to make sure you have all your documentation. So when you're submitting your application, and it is so important, I can't stress this enough, because, you know, these applications are going to be, the program ends September 30th. That's it. I'm not sure how much time they will give you. I know in the past, individuals have started their applications and then they will go back later to upload their documentation. I can't stress, like I said, enough to please reach out to us if you require assistance, because it's not going to be how it has been in the past. The program is ending. So there's no leniency or anything. When you submit your application, when you submit your documentation, September 30th, that's it. So if you don't have everything submitted, if you don't have all the requirements, then your application more than likely will be aborted. And you won't be paid for this, all the hard work that you've done throughout the attestation. So the number one thing, I want to make sure you have your verification of use letter. I mentioned that on the previous slide, containing your certification number from your EHR. You want to have your patient volume, your PVC, saved as an Excel or PDF, less than 4 megabytes. You want to have your detailed encounter report. Because of the size, you may need to separate these. Of course, you want to make sure you have it. I mean, you guys submitted in the past, so you want to make sure you break it down by the insurance company, group each one together, and tally those out on the spreadsheet before you complete your PVC. And it says here at the bottom, provide a subtotal and a summary page. Excel preferred. Your security risk assessment, we've gone over that with the mitigation plan, dates for the mitigation, the name of the practice provider, and 2020 date conducted. So we want to make sure, like I mentioned, if you made any changes during the 2020, if you've had any issues or anything, you want to make sure you document that on that report, on your update, and document that on your security risk analysis. Your Promoting Interoperability report, that's your dashboard scorecard, the 90 consecutive days in 2020. Well, this is 2021, generated through your EHR, saved as a PDF or Excel. Your clinical quality measures, you want to make sure you have all those screenshots available to upload when you submit your application. And just make sure you have proof of 4 clinical decision support rules that support at least 4 of the clinical quality measures that you're reporting on. And then also ensure proof these were enabled during your reporting period. So the screenshots for the yes, no measures saved as a PDF, 5 clinical decision support rules, your drug to drug allergies. These are all documentation that has to be uploaded with screenshots, drug formulary check, and your grits screenshot. So here's an example of a screenshot that was submitted, or how it looked. I'm not sure what system this is. So this is how it should, this is how your documentation should appear in this type of format. And this is what you want to upload. Okay, so we're going to go over the submission documentation for exclusions or proof of activity. So the Cpoe exclusions, you want to make sure if you have any exclusions on that, you want to be sure to submit that. HIE exclusions, your registry's proof of participations. So if you reached out to a registry and they're not participating, they usually send you an email or something back. Please make sure you upload that documentation as well, stating that it's not required or you don't have to participate. Proof of application programming interface, API documentation provided to your patients. I spoke on that earlier. This is just kind of example. Maintain a copy of instructional documentation provided to patients to prove you have it, because if you're audited, they're going to come back and ask, how was this information disseminated to the patients? So you want to make sure you have proof that you provided this to the patients, because if you're audited, they're going to ask you to provide that documentation. And if you have any questions again around this, please just reach out to us and we can assist you with what you need for this requirement.
Thank you, ladies. I just wanted to mention that we are seeing a lot of issues with this particular measure for having proof of the API. It's not that the EHRs don't have it. It's part of the specifications for their certification. They have to have it. It's just that you may not be talking to someone at your vendor that's familiar with APIs. And so they may not. We had somebody today, the vendor told them they didn't have it, and they did, but that support person didn't know it. So if you don't understand what you need for this API, it's not as complicated as it feels like. We've got some good examples, but you need to have this, and you need to be giving it to your patients. That's the most important piece. You're supposed to be giving this to your patients so they can access their information through a third-party application on their smartphone, for example. So thank you. That's all I had.
Thank you, Liz. Okay, so here again, here's some submission tips. And like we said, this is the final year. We want to make sure that you get these applications submitted correctly and successfully. So prepare at least to spend an hour on your first submission. Set aside the time for an uninterrupted effort. Of course, we're here to assist to make sure it goes smoothly. Have someone back you up. It will be less stressful. Again, that's what we're here for. Have visual of your PI dashboard and quality measures, either another screen or a hard copy. You may want to have it right there. So if you have someone assisting you, like in the past, we've assisted people, even if we've done it in person in the past or virtually, we may have the screenshot or the dashboard, call the numbers out to them, or vice versa, just to assist, just to ensure everything is being entered correctly. Have your certification number available for copying. Have all your documents for upload in a separate subfolder. You have a PI 2021 e-folder. Yeah, so it's make sure in case you're audited that you have a folder with all your 2021 documentation requirements, your exclusions, in case you would need to access that, in the future. Okay. So here's the another important tip, answering the questions carefully as you begin your attestation. And I need to enlarge this a little so I can. Yeah, so for example, I know just to think back in the past, a provider had answered a question incorrectly. I think it asked, did they willingly do something to their EHR to hinder reporting, or however it was worded. And the provider answered yes. So of course their application got rejected. They had submitted on the deadline, and they wasn't able to go back and correct this particular question. So that's another reason why we ask you to reach out to us, because some of these questions can be tricky as to how they're asking them, and you may be confused as how to answer them. So just reach out to us and we can assist you with this. I don't know if Liz want to add anything else on the submission tips. I think there's a couple more pages on these submissions and the questions. Liz, did you have anything you wanted to add on these
But-
submission?
I think you covered the one that I was concerned about. And that was, it comes up actually on the next screen, I think, and it's not showing up on this one, but it is
Next
the
slide,
one.
please.
It's the one that I don't know if it's on. I don't know if you have a slide. No, you don't have a slide for it, but it's exactly the one you mentioned, where it
Mhm.
asks if you knowingly and willfully
Mhm.
blocked information.
Yes.
And that's a a big no. And if you're not careful with it, then you may be clicking yeses and not realize that's what you did. So just be super careful, or let somebody or us help you go through that piece.
And so this is just some other submission tips. Be aware of the quality outcome of high priority requirements. And these are your CQM reporting measures. Next slide, please. Most of the points, Liz, if you want to add anything, if anyone's on the line and have any questions for us, any providers, or need assistance with anything.
Selena, I did want to add that there seems to be a function that's available that not everyone realizes is there. And that's after you click the submit button, you can go in and review that application and ensure you want to go all the way down and click on where it says meaningful use measures. So you have to go down, far down on that review sheet and look at those meaningful use measures. And you go through and look at the right side column and make sure that each one of those measures, even the yes, no's, even the questions that you started with, say accepted on them. Because if you go through and there's a rejected, it means you failed.
Right.
And if you go in and check that the next couple of days, we might be able to help you get it straightened out. If you wait until next week, it'll probably be too late for us to do anything. But please check that. Go in and review your submission folder and make sure that all your measures were accepted.
So Brianna, do you have, is anyone on the line has any questions?
We did have one question that was submitted online. Let me just pull it up really quickly so that we can kind of go over it. It was only one question. And the question states, is it true that the SRA can be completed later in the year? Are the answers as of September 30th, or can they be can they be as of date completed? I'm not sure about that second part, but the first part of the question is it true that the SRA can be completed later in the year?
Yes, yes, that is true. And Brianna, if you would give me that person's contact information, we can
Sure.
reach out to them and give them some more detail around that. We did send something out on the hot topics, stating that the actual requirement that DCH recommended, but they did give the okay for you guys to submit the one, because at this point, a lot of providers have not completed an SRA for 2021.
And Selena, when the folks go through and they're doing their submission, then there's a place on the security risk assessment page that asks if you've done it. At the bottom of the page, you can attest. You can say, no, you didn't do it. And then at the bottom of the page, you attest that you're aware that you have to get it done before December 31st. And so that's right there in your mapper submission. It's very clear once you understand what it is. Okay, it's the one place, it's one of the places that it is okay to put no, that you didn't do it yet. But for goodness sakes, make sure that you get it done before the end of the year and that you have it available for an audit.
Just want to reiterate that it's important that you get your applications in as soon as possible so we can assist you guys with it, and just to ensure that you're uploading everything correctly. We want you to get this done successfully. The 30th is actually next week, next Thursday, I think. So we're just trying to encourage providers to get them done as soon as possible and to reach out to us for assistance.
Here are some additional resources should you need them. I'll kind of hover over this page for a moment. And we would like to extend a huge thank you for participating in today's webinar. Again, Hybrid Solutions provides monthly webinars every third Tuesday of each month. So next month, there will be a webinar, I believe. Yeah, so please feel free at any time to join our webinars. Again, it's on the third Tuesday of each month from 12 p.m. to 1 p.m. Also, feel free to contact us if you have any questions. The contact information for our project manager, Selena Williams, is below. So I'll help her with this page for 1 second. Again, thank you so much, and everyone have an awesome day.